Welcome to the channel, Thomas Musket. In today's episode, I'd like to touch on injury prevention, treatment, and self-diagnosis. Reason I've done this, so just suffering with you always can grade an injury into either grade 1 or grade 2 or grade 3. So, for example, I'm not really concerned about it's got a bit of a calf strain, which was a result of I think overcompensating with a bit of a hamstring strain, trying to not running with proper form. So kind of like just going to take a week off from running. Pretty confident it'll be healed and it'll be fully repaired and ready to go 2 weeks time for Spartan World Championships sprint over in Croatia. But can't wait for that. So just erring on side caution, taking a week off from running. But at the same time, I was also seeing a positive, working on my strength. Still be training. As much as ever. But anyway, yeah. So the reason why people are getting injured and that, especially now in my 40s and that, you got I say I can do anything as good as ever and that can still run and lift just the same. If anything, still on the upward curve and that, which which I'm very happy and proud to say. That at 43 years of age, still setting my partner on PBs and not declining in strength in any way at all. So yeah. But anyway, how to prevent injuries. Probably the two most reasons why people get injured. First, just to say that show off. Yeah, just register me. I'm actually wearing three t-shirts because I didn't know which one to put on for a video, so I've got 3 on. This one is, I'm going to take one off at a time. So this is me obstacle gym vest. I'm very proud to be part of the G team. You've got my name on there, Tom Musket on the back. Part of the team down at Tamworth at Dostal Quarry, Griffin Treads down there. Yeah, very proud to wear the obstacle gym vest. Yeah, so people are getting injured because they're either 2 reasons really. They're either say if you're especially if you're a beginner and that you've not been training very long, you kind of training with the wrong intensity and wrong frequency. There's the intensity and the frequency really. How often you're training and the intensity, how hard you're training. So if you start trying to do too much, too fast, too soon, you end up getting injured. So just always listen to your body. If anything's aching, let it repair. It's aching because the muscle fibers are repairing. Give it a day or 2 and they're repaired. If it's not an injury, you always know if something's an injury. This is touching on the last subject, self-diagnosis really, but you always know if you're injured because if, for example, now I've just got a bit of a calf strain, the 10 mile at Delamere, but I pushed as well. I really wanted to push it. Yesterday's running with Poppy, my dog, and that, she can outrun me, bless her, and that, she can keep running. I trained her to run that distance, and that, gradually over time. Very proud of her. My dog can run 10 mile off the lead with me. But anyway, yeah, the reason why, because if you're injured, because my left calf is just a bit of a strain in it. I had to, even stepping in through the gym door before, I had to tell myself I was trying to literally force myself from getting on the treadmill because I wanted to get on it. I was itching to get on it, and then I stopped. I thought, what am I going to gain? I'm not going to lose nothing just for a few days from not doing any running. So I'll soon, I say for every week off, it take you a week to get it back and so on. you know, so to get back to it, if you had to have a month off, it'd probably take you a month to get back to where you were, you know, so a week off, we were 2 weeks away from going over to Croatia, like, so if I just have a week off now and I'll be back, you know, should be pretty sure I'll be back running a week from now. It's just got to it's just a bit of a niggle from overcompensating with the hamstring, because I was worried about that. Because that seems alright now, but I was worried about it. I wasn't running, going downhill with proper form and that, you know, because I did feel it a little bit, but my hamstring's alright, but now my calf's a bit sore. So, but anyway, you always know if something's an injury, or if it's just what you call DOMS. If anyone don't know what DOMS is, it's an abbreviation for delayed onset muscle soreness. So, for example, anyone who's trained, or even if you've played any sport, it's always the next day, and then even the day after that, could even be the day after that, what you're aching. So it's delayed onset muscle soreness from the muscle fibres trying to repair themselves, which you don't feel immediately after the exercise. You feel it, you know, probably peaks at about 48 to 72 hours later even, and that, you know, so then I'd say about 48 hours it usually peaks, and then it leaves off. So if you've got, say for example, if both your quads are aching, say, or both your, anything with your legs, say your calves, both your hamstrings are aching, the chances are you're not going to be injured. It's just DOMS. But if you've got just one, for me now with my calf, so my calf is aching, you know, it's a little bit sore, but the right one's fine. So I know now it's just not quite repaired from the run. I've just damaged only a little bit, you know, damage to the muscle fibres in my calf. And I'm certain, because I know from previous any little injuries, always get injuries. And you never go any sportsman, the elites, you know, amateurs, semi-pros, whatever level you're at, you know, you're always going to get, very rare you get through a full year without getting some kind of little, you know, injury. But touch wood, like, you know, I've ever had nothing what's kept me out for a month, ever, you know, so, but anyway, yeah, so you always know if just one, say one of your legs is something, you know, paining it, and the other's fine, it's, you know, it's an injury, and stay off it. Don't train. You know, you're not going to lose nothing just by having a week or two off, let it repair. You'll see what's a week or two out of your life, you know, so stay off it, yeah. So this is what I'm going to do. But I'll see positives and get stronger in the meantime. One of, you know, the best benefits of training for running and strength, if you can't do one, I can do more. I can do, you know, more of the other in the meantime. Anyway, I get down to my next vest actually. So I'm very happy with my vest come in the post the other day. You can only get this if you've done 100 park runs. The park run would change my life in 2016. Got me to do my first outdoor run. It's not a fun run to me. Some people see it as a bit of fun, the park run, just because you don't get a medal and it's not chit time. The reason you don't is because it's free. It's a free timed run every Saturday morning at 9 o'clock all over the country and other countries. If someone's got a stopwatch on me and someone's trying to run, you know, head to head with me, and I can't help but give it everything I train, take my park runs very seriously, and try to always beat my best time. So anyway, a few weeks ago, probably about 2-3 months ago now, got me park run. He says 100 on the back. So I'm very happy to, I think you can see that. 100 park runs. You get a red one when you've done 50. Actually, I think you get a red one. Probably got it in here somewhere in my cupboard. Like, probably down here somewhere it is. Well, that's it, yeah. So you get that when you're doing 50, like, so. This is the 100 one, yeah. So yeah, be wearing this on next part run. I'll probably wear this sometimes with my obstacle gym vest as well, you know. So but anyway, so yeah, how to prevent injury. don't do too much too fast too soon at the wrong intensity, wrong frequency. You know, so do if you're just a runner, which I'm not, I'm probably running about 600 or 700 miles a year, say 1,000 kilometers it comes to, which is some of the runners who just run and run only, they're doing more, at least double that. You know, the serious runners they're doing you know, probably doing, say, you know, he's way over 1,000 miles a year, and I do about 600 or 700 miles. I train 6 to 7 hours a week, split between running and gym and a home workout, and I always make sure I get me 6 hours a week in. You know, so yeah, but anyway, but also the best way if you do get an injury is to so rest and recovery. The best thing you can do, your body heals in your sleep. Your body will release HGH, human growth hormone, into the bloodstream when you're asleep. Your brain will divert iron and oxygen from the brain because it don't need it when it's asleep, and filter into the bloodstream to help your body repair itself during sleep. So plenty of sleep, because it's the best thing you can do to help yourself repair from injury. You know, eat a good diet as well, and that, you know. So, but yeah, yeah. So also, you know, warm up properly and that. Don't just start running. You know, anyone who you know, half serious, you know, runner, exerciser, you know, you always know this anyway, that you should warm up. You know, don't just go out the door and start running or something. You know, a cold muscle's gonna more likely to pull, get tight and get injured. So warm up the muscle, just do a few, you know, exercises, you know, just on the spot and that. A few bit of stretches, a bit of twists and turns, you know, just gets everything warmed up and that, ready to go, get your heart rate up and that. And then, and bit of, sometimes, to be honest, I neglect this, a bit of a cool down after. You know, bit of a steady run after, which I'm very guilty to say that I don't really do this myself. Bit of a warm, like a warm down run. I can do I do a warm up run, especially, you know, for a race, like, but not really. So that's maybe something to look at adding into my training and that, you know, to spend more time stretching and warming down properly after, you know. So yeah. So anyway, yeah. So prevent injury. How to prevent it? Not how to treat an injury. There was a lady in the shop in the supermarket not so long ago. She was in front of me and she's telling the shop assistant how she's had a back badge for 6 months and she's still putting deep freeze on it. So I interrupted and, you know, I gave her advice. You know, I sold them a YouTube channel, gave her advice, told her, you know, she didn't know what she's doing. She's putting freeze on for 6 months, which is stopping the blood getting to the muscle, because blood's gonna help the muscle fibers repair. So personally, I stay away from ice and heat, because the best thing you can do for a muscle, for injury to repair, is time and rest. You know, so people talk about, you know, RICE, which is an abbreviation for rest, ice, compression, elevation. But I take that I out. I won't bother. I don't even put ice on. I don't, because you're not sure if you're doing more harm than good. Because the reason why you get inflammation around an injury is because it's the body's natural response to protect the injury is inflammation, which protects the injury. So if you just keep putting ice on and that, yeah, you're not gonna feel as much pain and that, but you're gonna get rid of all the inflammation too soon. Just leave it. Honestly, just leave it and let it heal. And that, or some people even worse, to start putting heat on straight away, gonna make it completely more inflamed and that, and cause themselves more pain by putting heat on a new injury. Just leave it. You know, and be patient. You know, so it's going to do self more damage. And then, because once again, people will write me off. People write me off and say, even done it in my 30s. You say you're in your 30s, or you get an injury. Just say, oh, you're getting it's old age. So I'm not going to swear, but I don't even listen to these people who are disrespectful and say I'm injured because I'm getting older. Because I've had the same amount of injuries at the same frequency since I started training at the age of 25, and I'm not injured anymore, and I'd even say definitely I recover faster from training now, because my body's used to it, and I know how to take care of myself better, and that with sleep and diet I recover faster now than ever. So don't bother saying that to me, that I'm going to be injured because I'm getting older, because I would say that you can be more prone to injury as you get older, and that. But I wouldn't say, I'm not contradicting myself. What I'm trying to say is that because everyone's got two ages, your chronological age, which was the year that we arrived, so for me 1981, but your biological body age is how much your organs and how much you're genetically aged in that time. So I'd very much like to think that I slowed down the aging process. So I mean results, what I mean running times and all everything, that I've not even actually peaked yet. But I've not also, to be fair, I've only not peaked yet because I didn't even start running until I was 35. If I started training and competing at 15, 16 years of age, my prime would have definitely been and gone by now. But I don't believe that I'm injured because I'm getting older. Right? Because I've not have any more injuries now than any more worse or frequency than I have. And when I have, I'll be the first to come on here and say that I'm no longer in my prime. I'm getting injured easily. I'm not repairing, not recovering fast. I'm struggling. I can't quite run as fast. I'm going to come on here and announce it. So don't worry about that. But I believe that the best is yet to come from Thomas Muskets. I'll just get on to my next t-shirt, which is a t-shirt I bought from a very good friend of mine at a company who I work for in Sandbach. So this is a t-shirt. I'm not allowed to say the company's name. I don't think on YouTube to advertise it, but it's for a construction company in Sandbach. Any of my subscribers down there as well. Chris Briggs, my manager, if you're watching, I know he's subscribed to the channel. I hope you're well, Chris. I'll see you in the morning, bright and early. It's a very good company. There's a very good friend of mine, Will Thornburg, brought me this t-shirt. Conquer your obstacles. I mean, we talk all day, me and Will, we get the work done, but we're talking all day. We talk a lot about life. When life is an obstacle race. You go along in life, you counter an obstacle, and either find the mental strength and resilience to get over this obstacle in life, and you're stronger for it. So you conquer your obstacles physically, mentally, in life, in training and everything. So I really like the t-shirt, very nice fit from Will Thornburg. A lot of respect for Will. Will in his 60s, and I say he's still fit and stronger than a lot of 20-year-olds out there. Will Thornburg. Hope you're watching, Will. I'll see you in the morning. I've actually got you. I don't know if it's spoiler surprise, but I've got you 5 protein bars, Will, and there's some coconut water what I'm bringing in for us tomorrow. Don't any money, after he bought me his t-shirt. So I'm going to bring the protein bars in the morning, Will, for us 5 each. It's last us all a week. Very good, mate, Will. Yeah. So anyway, but also I've just got something, a little gadget. What stop you getting not stop you getting injured, but just help stretch off. Every morning put a kettle on and I'll stretch all my tendons and ligaments giving those joints a stretch. And that brilliant piece of equipment is resistance band. You can get different strengths and that, you know, and it really helps. My tendonitis is loads better than it was say 2 or 3 years ago. I get a bit sore tendonitis in my upper arms, my biceps, my shoulders, and it's really down to this, I believe. And you can, you know, use it anywhere. I use it either in, you know, the I've got one here, I've got one at work, one at the missus' house, one in the car. So I've always got one, you know, I can stretch, you know, stretch all my legs and that. I do work with Aaron. Can't remember his second name, Aaron, if you're watching. But yeah, I've given him a resistance band last week to want to start building a bit of strength. So you know, it's good. It's not a bad start for someone if you want to start this. If you're a beginner as well, you can tone yourself up using these. Like, you know, so these are great for injury prevention as well. Like, you know, keep stretching. So yeah, injury prevention, treatment and self-diagnosis we've covered. Don't bother going to doctors. I've not registered at doctors for 10 years now, and I won't be going to doctors again in my life, because to me, you know, they're just you're just a number. I walked out of my last appointment when I had a shoulder injury, and he just fobbed me off with told me to take some ibuprofen and on my way. Couldn't wait to get the next patient in. So I can always diagnose myself, and that if it was in a bad enough way in any way, I'd be in hospital. So don't bother going to doctors if you get injured, because they don't know really what they're talking about with that side of things, injury, and that all the doctor sees is medication, out the door as quick as you can get the next patient in. So yes, if just self-diagnose yourself and that, you know, with injuries. So like I say, the best way to know if you've got an injury, say with your legs, if one's aching, if both are aching, it's most likely delayed onset muscle soreness, or if just one's aching, it's most likely to trigger a bit of an injury. Like, but yeah. Anyway, thanks for tuning in. Thomas Muskett's on YouTube. This was my final t-shirt, but sort of show. Take this off. Just to show I'm still, you know, decent nick. 43 years of age. You know. Hopefully, you know, I'll stay injury free, and the best is yet to come from Thomas Muskett. Thanks for tuning in. See you on the next video. Take care of yourselves. One body, one love, Thomas Muskett.